There's good and bad news out on the cancer front today. The good news, cancer death rates overall are falling across the country. But here's the bad. Americans who are less educated are far more likely to die from cancer. Take a look at this with me. The American Cancer Society reports that Americans with the least education are more than 2.5 times as likely to die from cancer as those with the most education. The study also finds that more than a third of premature cancer deaths could have been avoided if everyone had a college degree. Joining me now to discuss this study, the Chief Medical Officer for the American Cancer Society, Dr. Otis Brawley. Thanks so much for coming in and talking about this. I'm curious, why do you think we're seeing this discrepancy in education levels?
Well, socioeconomics actually end up being an indicator for poverty, causing more smoking, more obesity. People are less likely to exercise. A lot of things that we know that prevent cancer are more common in people who are wealthy or people who are middle class. People who are poor have worse health habits, and then, of course, access to care.
That is a big one. I want to show you some other numbers. I know your study also finds that even though they've slowed, cancer death rates are actually higher for African Americans than whites, despite the education level. So look at this here. 33% higher in African American men, 16% higher in African American women. Again, why are we seeing numbers like this?
Yeah, the drivers among African Americans are actually the same drivers among people who are poor. More likely to have obesity, more likely to not exercise, healthful habits, and then access to care, including preventive services being lacking.
I also want to talk with you about the deadliest cancers.
Yes.
Lung cancer certainly is the #1 killer for men and women. Breast cancer, if you take a look at our list here, breast cancer is #2 for women, prostate cancer #2 for men, and colon cancer is #3 for both. But let's get back to the #1 killers. We just said lung cancer. I mean, your report says that those with high school education or less died at a rate 4 to 5 times higher than those with at least a 4-year degree.
That's right.
Those numbers are alarming.
Yeah, and that is actually almost totally related to smoking. You know, smoking kills 1/2 of all people who smoke. And much of it is by cardiac disease or by cancer. Lung cancer is the most preventable cancer. 80% of people who develop lung cancer develop it because of smoking.
And you look at this discrepancy, I mean, does it come down to risky behavior? I mean, those who are less educated just aren't educated about taking better care of themselves. They may drink, they may smoke.
I think that's part of it. Sometimes when you get into inner cities, people just don't have much hope and don't really care about health as much as people who are in a more middle-class environment. We need to start focusing on poverty. Indeed, we talked about cell phones and other things causing cancer. Poverty is a much greater killer than any of these other things we've been talking about recently.
Did anything in this study surprise you? Any of the findings?
Yeah, I've been close to this data for about 20 years, so it just confirms many of my suspicions. So I can't tell you I was really shocked. I do hope people actually start focusing on the fact that we need to try to figure out how we can get adequate health care, including preventive services, to people who are not getting them and people who quite honestly deserve to get adequate care.
Yeah, it's so important so we can turn some of these numbers around. I agree. Thank you so much for coming in and talking about it. Very important issue.